Hello and welcome back to my channel. If you're someone who's experienced a dull, aching pain across your forehead or around the back of your head and neck, you might be dealing with a tension headache. In this video, we're going to dive deep into what tension headaches are, why they happen, how to recognize them, and most importantly, how to manage them effectively. Whether you get them occasionally or more frequently, this video is for you. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Tension headaches are the most common type of headache, and most people will experience at least one in their lifetime. They're sometimes called stress headaches, and that nickname gives a good clue about one of the primary triggers. These headaches typically feel like a constant dull pressure or tightness, almost like a band squeezing around your head. The pain is usually mild to moderate and tends to be felt on both sides of the head. Unlike migraines, tension headaches don't usually cause nausea or sensitivity to light and sound, although some people may report mild sensitivity. Tension headaches can last anywhere from 30 minutes to several hours, and in some cases they can persist for days. If you get them fewer than 15 days per month, it's considered episodic tension type headache. But if they occur more than 15 days per month for at least 3 months, it's considered chronic tension type headache. Now, let's talk about what causes tension headaches. The exact cause isn't fully understood, but they're believed to result from a combination of factors involving muscle tension and altered pain perception in the brain. When the muscles in your scalp, neck, or shoulders become tight or contract, they can trigger this type of headache. Common triggers include stress, anxiety, poor posture, fatigue, and even eye strain. For example, spending hours hunched over at a computer or squinting at a screen can strain the muscles around your head and neck, setting off a tension headache. Other potential contributors include jaw clenching or teeth grinding, which often happen unconsciously during sleep or periods of stress. Dehydration, skipping meals, and inadequate sleep can also increase your likelihood of experiencing a headache. Recognizing a tension headache is often about distinguishing it from other types of headaches. The pain is usually described as a dull, aching pressure located across the forehead, temples, or back of the head and neck. They are usually mild to moderate in intensity and steady rather than throbbing. They are not worsened by routine physical activity, unlike migraines. You may also feel tightness or tenderness in your scalp, neck, or shoulder muscles. But again, unlike migraines, tension headaches typically do not come with visual disturbances, severe nausea, or vomiting. Even though tension headaches are common and usually not dangerous, it's still important to know when to seek medical attention. If you suddenly develop a severe headache that's unlike any you've had before, especially if it comes with symptoms like confusion, weakness, vision changes, or difficulty speaking, that could be a sign of something more serious and should be evaluated immediately. You should also talk to your doctor if your headaches are becoming more frequent, more intense, or are interfering with your daily life. Chronic tension headaches, in particular, can greatly impact your quality of life and may require a more comprehensive treatment plan. Diagnosing a tension headache is usually based on your symptoms and medical history. There isn't a specific test for tension type headaches, but your healthcare provider might ask detailed questions about your headache patterns, triggers, and associated symptoms. Sometimes, if your symptoms are atypical or if there are signs of another underlying condition, your doctor may order imaging tests like CT scans or MRI to rule out other causes, such as a brain tumor or an aneurysm. But in most cases, a thorough history and physical exam are enough to make the diagnosis. Let's move on to management, which is what most people are really looking for when it comes to tension headaches. If you're dealing with a tension headache right now, over-the-counter pain relievers can be quite effective. Medications like ibuprofen, acetaminophen, or naproxen are often enough to relieve the pain. These medications are best taken early at the first sign of a headache rather than waiting until it worsens. That said, it's important not to rely on pain medications too frequently. Using them more than 2 to 3 days per week can lead to rebound headaches, or also known as medication overuse headaches, which can make the problem worse over time. Other immediate strategies that can help include rest, applying a warm or cold compress to your head or neck, or practicing gentle stretches to relieve muscle tension. Sometimes just stepping away from a stressful situation or taking a short nap in a quiet, dark room can do wonders. The real key to dealing with tension headaches is prevention. Since they are often triggered by stress and muscle tension, lifestyle changes can play a major role in reducing how often they occur. Let's start with stress management. Learning how to manage stress can significantly reduce the frequency and intensity of your headaches. Techniques like mindfulness meditation, deep breathing exercises, progressive muscle relaxation, and yoga can help you stay calmer and reduce physical tension in the body. Regular physical activity also plays an important role. Exercise helps reduce stress, improve sleep, and releases endorphins, which are natural painkillers. Activities like walking, swimming, cycling, or even stretching exercises like Tai Chi can be very beneficial. The key is consistency. Aim for at least 30 minutes of moderate exercise most days of the week. Improving your posture can also go a long way, especially if you spend a lot of time at a desk or on your phone. Try to sit upright with your shoulders relaxed and your computer screen at eye level. Take regular breaks to stretch and change positions. Poor posture can strain the muscles in your neck and shoulders, setting you up for headaches. Paying attention to your sleep habits is another important piece of the puzzle. Aim for 7 to 9 hours of quality sleep each night and try to go to bed and wake up at the same time every day. Sleep deprivation is a common trigger for tension headaches. Don't forget about hydration and nutrition. Drinking plenty of water and eating regular balanced meals can help stabilize your energy levels and prevent headache triggers like low blood sugar or dehydration. For some people, keeping a headache diary can be very helpful. Writing down when your headaches occur, how long they last, and what might have triggered them can reveal patterns and help you and your doctor find the best ways to prevent them. If you have chronic tension headaches, meaning you're getting them more than 15 days a month, your doctor may recommend preventative medications. These are typically taken daily to reduce headache frequency and intensity over time. Common options include low-dose tricyclic antidepressants like amitriptyline, which can help with both headache prevention and sleep. In some cases, other medications like muscle relaxants or anticonvulsants might be used, although they're less commonly prescribed for this purpose. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, in addition to medications, physical therapy can be helpful, especially if muscle tightness or poor posture is a major factor. A physical therapist can teach you exercises to stretch and strengthen your neck and shoulder muscles and improve your overall posture. Massage therapy and acupuncture are alternative approaches that some people find helpful. While the scientific evidence is mixed, many patients report fewer and less intense headaches with these treatments, especially when used alongside other strategies. Tension headaches may be common, but that doesn't mean you have to suffer through them. Understanding your triggers and making a few lifestyle adjustments can go a long way in reducing how often they occur and how much they impact your life. Whether it's practicing stress reduction techniques, improving your posture, getting more sleep, or working with your doctor on a treatment plan, you have options. And you don't have to face this alone. Thank you for watching. As always, take care of yourself and make the most of your day.